In a bid to boost effective service delivery, the Initiative for Grassroot Advancement in Nigeria, INGRA-NIGERIA, has organized a one-day capacity building workshop for community health workers on tuberculosis under the control of Global Fund GC7 Project for the Eastern Senatorial District of Kogi State. The training, aimed at boosting effective service delivery in TB control, brought together community TB and HIV workers, tuberculosis and leprosy supervisors, assistant TBLSs, and DOT officers from various local government areas within the Senatorial district. Speaking during the session, Dr. Komolafe Rotimi, the Kogi State TB Program Manager, emphasized the importance of continuous capacity building to strengthen community-level TB case detection, referral, and treatment adherence. He noted that the fight against TB requires commitment and collaboration among all stakeholders to ensure no case is left undetected or untreated.
TBLS, nothing concerns you with what they call it, community register, except you just want to get information there about how many were screened. Why do you have an assistant? Take for example, a local government can have close to 50 dot sites. You alone cannot effectively supervise all this one. Let our assistant go to somewhere, you go somewhere if you have properly trained them. Dot provider, what is your job? When the CTHW go to the community where you live, where I live, where all of us live, and they have been able to get presumptive cases, they are going to bring it to your facility to document in the presumptive register. And out of those presumptive, anyone that is positive, it is still the facility register with you that they will document it. Why are you the most important in this room? Drug provider is the only one qualified to have drug in their possession and TPT drug in their possession. They also have some registers that they fill. When you see drug with a TBLS, please be sure, most likely that TBLS want to go and deliver it to a drug provider. CTHW, your job is to go to the community, organize outreach. How do you organize outreach? With the help of your TBLS and your drug provider, I want to organize outreach here. I have to identify which dot site is closest to where I want to organize outreach. Make sure it is a place where there will not be too much stress for the patient to go and be collecting their drug. You see, if you don't do it well, you yourself, you are at risk.
Also speaking, Mr. Hamza Aliyu, the Executive Director of INGRA-NIGERIA, highlighted that the training aligns with INGRA's mission to enhance grassroots health systems and ensure efficient service delivery. He stressed that empowering community health workers is vital for achieving the overall objectives of the Global Fund GC7 Project, particularly in improving TB control outcomes across Kogi State.
Contact tracing, what is it? You're tracing the contacts of index cases, right? When somebody is already on treatment, it becomes an index case. You go back to that place, to the household, and screen everybody in that household. Either you want to screen the person using the oral screening, those 4 questions, or you screen with the VDS machine, anyone want to do. Anyone that turns out that is qualified as a presumptive, you also collect sputum. And you go send back to your lab. If they turn out to be positive, they become a case. If they turn out not to be positive, those who are qualified for TPT, you place them on TPT. Outreach, TBLS must be informed. And you must show us that TBLS was informed, because they are going to sign off on your report. 2, dot officer must be present. That one is not that the dot officer must be informed. No. The dot officer of the nearest PAC where you're doing your outreach must be present. A picture must show the dot officer sitting down in that place and being part of that activity. CTHW must be present. You who is conducting that outreach, we need to see you in that picture.
Participants expressed appreciation to INGRA-NIGERIA and the Global Fund for the opportunity to refresh their knowledge and skills, pledging to apply the lessons learned in their respective communities to improve TB service delivery.
There are a lot of things I didn't know before concerning the documentation. Yes, a quality documentation has to be done in the register and on the ComTB app.
The documentation aspect is very, very critical, which is part of it. In fact, it is the father of the work, because if you have somebody who is TB patient and you don't do documentation, it is assumed that you have not done anything. But when your documentation are intact on the community register, on the presumptive register, on the treatment register, on the treatment card, on the ComTB app as well, and the e-presumptive, if your documentation are intact, which means you have done your work exclusively.
Documentations, if you work and you are not documented, it means the work is not done. I learned a lot about the documentations. Well, as I'm going home now, we'll go and know how to arrange and do the step-down training for other DOT providers that are not here.
Like, to know the full meaning of DOT officer, I don't know. It was today I knew about it. It's direct observation therapy. And again, there are some things that, like to find a TBL in a child, there are some signs and symptoms that we need to know.
He have taught us many things concerning the TB, how to fill the form, how to identify the presumptive cases. So the trainings was so good. My take home after this training, if I go back to the house, I will now gather some of my DOT provider so that I can give them on-the-job training for what I have learned from today.
I learned contact tracing. I have learned the signs and symptoms of tuberculosis.
The training was okay. We are taught so many things, how to collect the sample, then how to do the transportation, and they even taught us again the signs and symptoms of TB.
Normally we don't have children, but the way we were taught today, we know how to diagnose the children anywhere that we are. If we are doing our outreach now, we can diagnose the children easily.
They taught a lot of TB, how to diagnose TB, how to move from one house to another, to find out the children that have TB and the adults, the signs and symptoms you can use to identify children with TB and adults with TB, and a lot of things we're saying concerning documentation, proper documentation, both community register, presumptive register, central register, treatment card. Many things has been taught.
The one-day capacity building session reaffirmed INGRA-Nigeria's commitment to promoting quality healthcare and strengthening community structures for better health outcomes in Kogi State. Reporting from INGRA Media, I am Reshi Agabi.